Okay, so thank you very much for joining everybody. Today's session, Maximising GPREG. So first, just a little bit of information for you. So today's presenters are myself, Claire Temple from Redmoor Health, and we're joined by Ian Jones from the NHS England team. Just a bit of housekeeping. So just be aware that we are recording the webinar today, and your microphones and your videos are being turned off just while we go through the presentation. But if you do have any questions throughout, please pop them into the chat and we'll get to them at the end. Just a note as well, so if you haven't registered for this session directly, so if you used a link that someone else has shared with you, please just make sure that we've got your email address, job title and organisation in the chat, just so we can make sure you're invited to the D&T network and that you can get all of the resources that we're going to send out after today's session. Okay, so today this session is brought to you by the D&T network. So this came to life in September 2024 with an aim to connect everyone across healthcare that's interested or involved in digital and transformation. And we've currently got just under 1,300 members from all roles in primary care on there. You can join the network by scanning the QR code that's on the screen. But after today's session, you'll also be receiving an invite to join. Please check your junk folder because sometimes it goes into there, but we'll continue. So the agenda for today. Today we're going to be looking at GPREG and the auto registration feature, but the session is also about how digital registration only saves time if the rest of the process changes as well. So we'll start by reframing patient registration and looking at it as an end-to-end admin workflow, not just a form that's moved online. And from there, we'll explore where practices typically lose time through any duplication, manual checks, and fragmented processes. We're then going to focus on digitising patient registrations for practices already using GPREG, including how patients register through the NHS app, the NHS website or practice websites, and what happens behind the scenes. We're going to spend some time explaining what auto registration is, who qualifies and how it works in practice, including the difference between registrations that flow straight through and those that still need some manual handling. We're also going to cover the benefits of GPREG and auto registration in practical terms, particularly around the admin time saved, faster confirmation for patients and the reduced follow-up work. And after that, we'll look at how GPREG fits into the wider admin workflow, including clear ownership, exception handling, and how admin roles may need to evolve to really feel the benefit of that. We're also going to talk about using registration as the starting point for digital onboarding. So things like the NHS app, signposting, messaging and what happens next communications, and how improving that patient information can prevent avoidable work later. And then later we'll finish by outlining what additional support is available to help embed these changes at practice, PCN and ICB level, before we're going to open up for some questions at the end. Okay, so first I wanted to start by reframing how we think about registration. So digital registration on its own doesn't automatically save time, but it saves time if the rest of the process changes as well. Practices may be using GPREG. Some feel it is just as busy, but that's usually because GPREG has been added on top of existing admin processes rather than replacing them. And what we sometimes see is admin teams still chasing ID or proof manually, even when most of the information has already been submitted. Staff re-entering demographic details or communication preferences that are also in the clinical system, and then multiple inboxes being checked every day. So the GPREG, emails, messages and paper, just in case something's missed. So although the registration form is digital, the workflow behind it is still largely manual. But the key shift we're encouraging is to see GPREG not as a form, but as a starting point of wider admin workflow. And when GPREG is treated as the trigger, especially alongside auto registration, practices can reduce that duplication, you can stop the unnecessary manual checks, and you can focus admin time only on the registrations that genuinely need that human intervention. And that's the lens that we'd encourage you to listen to through Ian's session, not just what GPREG can do, but what you can stop doing once it's embedded properly. So in a digitally enabled practice, registration feels simple and joined up for both patients and staff. The first step is that the patient registers online using GPREG. And for those who meet the criteria, that registration then flows straight through automatic registration without the practice having to touch it at all. There is the other option, which if it does not meet the national criteria, there are a few manual steps. But from the patient's point of view, their registration is confirmed quickly, they're guided into using the NHS app, and they receive clear digital messages about what happens next. And there's no need to chase the practice, no uncertainty, and no extra phone calls. And from the practice's point of view, the admin team isn't processing every registration. Some will still require a manual process, but this can be made simpler with refined processes and message templates that include that welcome message and what happens next, and signposting to the NHS app. This shift to auto registration is important because this turns digital registration into real time savings, not just a different way of collecting information. And each auto-registered patient typically saves 5 to 10 minutes of admin time each patient, which soon adds up. And before we talk about the benefits, it's worth being honest about where time is still being lost in day-to-day practice. And most of this isn't because teams are doing anything wrong. It's usually because old habits are still sitting alongside new digital tools. Some very common examples that we see are printing registration forms in the practice, just in case, calling patients to confirm the information they've already submitted, manually adding those consent flags or preferences that could be set up digitally, and spending time answering calls that start with, I registered online, am I registered yet? So each of these tasks feels small on its own, but together they can add up to a significant amount of admin time every week. And what's important is that we recognise that these steps often exist because the process hasn't been redesigned, not because GPREG doesn't work. When practices move to automatic confirmation where possible, clear digital messaging to patients, and a model where admin teams only touch registrations that need attention, many of these time drains will disappear. So I'm going to pass over to Ian now, who's going to talk us through the national capability, particularly auto registration, and what's coming next. And what we'll come back to at the end is how you can make sure your local processes take advantage of that. Thanks, Ian.
Great stuff. Thank you, Claire, and good morning or good afternoon to everyone. It's great to see so many people on the call and so much interest in our session today. So my name's Ian Jones. I'm the National Products Implementation Lead for the Register with a GP Surgery Service. I'd like to start kind of my little bit by making it a little bit interactive. So if you can use your React icon at the top of the screen. So can I be a patient at your practice, please? I'm an adult. I've used GPREG and I've entered my NHS login to register. I'm P9 verified. I live in your catchment area. I'm transferring from another practice in England, so I'm a type 3 registration, and I don't have any prior immediate removal or an 8-day removal, so the patient relationship breakdown from your practice. So I can see lots of thumbs, which are absolutely great. Conversely, give me another reaction if I wouldn't be welcome. Any of those? That's absolutely brilliant to hear. Thank you so much for that response. So where does that lead us? So those are the qualifying criteria that we use for auto registration. So this is the first of 2 initiatives that we're slowly but surely delivering on your behalf across registrations across the country. So those criteria are the criteria that we use for auto registration, like I've said. And what auto registration does is integrates our service, so that's the patient front end, directly into TPP. Now, I'm sorry for those Optum practices on the call today. We're not quite there with Optum, and I'll have more information about where we are with Optum EMIS practices shortly. But this is only currently available in TPP System 1. So what do we do on your behalf in auto registration with that data for those that qualify for the kind of the inclusion? We migrate the data directly into TPP from the GPREG submission. We create the new patient record on your behalf. We allocate the GP as per your contractual requirements. We confirm the registration back to the patient. That's all done by an NHS Notify. So Notify uses a combination, or can use a combination, of app, email, text, and if all of those fail, we'll send a letter, and all of that is free of charge. And for 95% of the submissions that qualify for auto registration, we're confirming their registration with your practice within 30 minutes. And what that in turn does is saves time in the wider health economy. So 30% of registrations that you get currently today from us could qualify for auto registration if you enable it. It will save you a further 5 to 10 minutes, and that disparity is because we still know that some practices are receiving an email from us, they're printing it, putting on their document holders, typing that in, and that can add to both admin time at your end, but also you could also introduce typographic errors that we've already validated and verified using our PDS trace and NHS number trace. So please do just use the cut and paste directly from our form into TPP, and those that are using EMIS. The other benefit for you as a practice is that you don't need to administrate the acceptance of the registration. That is all part of the work that we do on your behalf. From a patient perspective, because so many submissions could go through the auto registration functionality in such a short space of time, they're confirmed as patients. They get a message within that 30-minute time frame, or the vast majority do. But what that in turn means, if they've come through that GPREG journey using auto registration, there's reduction in the burden on 111, because what we're finding is that patients, while they're waiting for registration via a kind of a paper-based mechanism or process, will often be waiting days, if not extending into kind of maybe 5 to 10 days. Which then in turn, while they're waiting for that, they're picking up the phone or using NHS 111 online to ask for primary care help. So we can reduce all of that as well. Maybe there are some of you on the call today that are using Health Tech One or GP Automate. So where does that all kind of fit into? And I'm pleased to say that auto registration can dovetail alongside these solutions. Any registration that meets the auto registration criteria will go through and be processed by us, and obviously that will then lead to a registered patient. For any patient that falls outside of the criteria, they will then be processed via the automation provider. In turn, what that means for you is that you're only paying for 30%, or you're paying for 30% less for your use of the automation solution. And again, the key benefit for the patient is that because we're able to process so many registrations or submissions through auto registration so quickly and confirm that registration, for Health Tech and Automate, because the practice have to administrate that acceptance, the patient isn't confirmed in anywhere near as quick in terms of timelines. We've made enabling auto registration at your practice really easy. So the easiest route for you is the bottom one. You can email us at that email address, or you can turn it on yourself via Profile Manager in 2 or 3 key steps. Unfortunately, we aren't able to automate all of the information that you receive as part of the GPREG submission, but you do have access to the PDF that accompanies the registration submission in the recorded attachments area in CPP, and you can easily migrate the data from that form into your clinical system. And their emergency contacts, which we're hoping to still snowmare code, but we're just waiting for TPP and Optum to do that. Previous GP details, again, we're waiting for some protected development time from both the clinical systems, and any free format fields such as pre-existing conditions. So if they're not blank in the attached PDF, we kindly ask you to migrate that data. So what about those of you who are using Optum or previously EMIS? Unfortunately, we're not quite there yet. We've had a number of issues and challenges with Optum over recent weeks and months, but we're working through them with the team now, and they've been a lot more conducive to kind of our requirements. We're hopeful that the pilot being stalled will quickly be lifted in the coming couple of weeks, and hopefully we will then be able to move into a national rollout for Optum EMIS like we are with TPP. But if you're desperate to kind of jump the queue, so to speak, on the back of the delivery today, just email us at that address at the bottom of the screen. And once we move into a national rollout for Optum EMIS, we will be able to turn that on for you. But like Claire mentioned, that the benefit will only happen at your practice if you raise the levels of digital uptake within your practice. And a lot of you are already doing this already. So we're already seeing significant numbers of practices. I think it's around 60% or more practices across the country that have 80% or more of their registration traffic going through the national digital service. Why it matters: higher use equals greater automation. And as we deliver the further initiative later this year, which is the Managed Patient Registrations Portal, where once that's delivered, all of the manual admin tasks to move data from one into the other will be a thing of the past. So it's really important for you to kind of move as much traffic as you possibly can. And there's lots of support that we can provide. If you reach out to us as a team, there's lots of resource materials that we can share with you to support patients migrate from, the default of paper-based to a digital journey. So what are the expectations? So back in April 2024, the GPREG service was mandated via the kind of GP contract and the primary care legislation. And what that meant was that there are now only two acceptable forms of registration across England. And they are the GPREG digital form and the new PRF1 form, which replaces the decommissioned GMS1 form. But we still are finding there are lots of practices that are struggling with their digital uptake, who still are using and supporting registration journeys using legacy links on web forms and old paper forms that the practice has put into place. They now need to be decommissioned. And again, if you need any support with that, please do reach out to us as a team. We'd be more than happy to guide you through the key steps, what you need to do. But the key benefits to you are that there's certainly and significant less manual workarounds for you to put into place. We want to automate the journey. We want to make sure that we're following through on the 10-year plan, creating those analog to digital journeys for you. And with your support, we move your practice in a much better position. As I've mentioned, what are the key things that you need to do? So make sure that you're using the GPREG URL on your new patient registration or join our practice registration areas. A lot of practices have it from their front screen, literally directly into GPREG. If you've got any existing use of legacy forms that have been provided by your website provider or a practice form that you've created yourself, they need to be removed. I know some of you still want to ask additional questions, but you can then use a secondary form, but it may only consist of those 4 questions that don't exist in the GPREG pathway. And again, if you want to know what they are, please do reach out to the team and we can let you know what they are. Please remove any references to the GMS1 form. The GMS1 form was decommissioned in October 2024, and we've got a brand new paper form available to all practices that contain all of the questions that we ask in the digital version. I did touch on this earlier, but just a reminder of what the GPREG core service benefits are. So for every single submission that comes through the digital route, we complete a PDS trace. That's the first thing we do. We do that for every single patient so that you know that the information you're getting is validated and verified. For 95% of all submissions, we've confirmed and validated an NHS number. So where the patient has entered an NHS number, we validate it and verify it. But where they haven't entered it, we go away using the kind of unique identifiers, and where we've been able to match that with an NHS number, and that's 95% of all submissions, we confirm that back to you. The other bit that we do is the catchment area. So we use the EDEC catchment areas that you declare, and we consume that information and make sure that where a patient has entered their postcode, that it's in your catchment area. If they're not within your catchment area, we send them back to where they started, so they have to choose a different practice to apply to register at. If your practice accepts out of catchment area patients, when we send you the submission, we will confirm to you whether the patient is in or outside of your catchment area, so that you can then tell them what they can and can't access within your service. What that all means is that we've been able to drive down PCSE exceptions. So we've reduced a lot of the duplications and confusions because we do that spine match, that PDS trace and that NHS number trace. But that can only happen if the registration comes through via the digital service. It's free to use, centrally provided, you know all of that, and it meets all of the web accessibility standards, etc. So why not migrate as much traffic as you possibly can through the nationally mandated service? If you want to know more about auto registration or increasing your usage, we do run weekly webinars that Dan Carver, Saj Mushtaq and I run on a weekly basis. So please do join us. We'll be able to give you all of the kind of up-to-date and much further enhanced information about auto registration. Please do dial in if you're EMIS or Optum, previously EMIS practices, because we'll be able to tell you when that's available in your clinical system as well. Thank you. That's it from me. I'll hand you back to Claire, and really appreciate you taking the time to listen in today. Thank you.
Thank you very much, Ian, and I hope that was useful for everybody. It's definitely a great service and it's free, so good idea to take you up on that. So just moving on from GPREG, just to make sure that we are embedding GPREG into the wider admin workflow, the most important things that we need to have is one agreed internal process rather than GPREG sitting alongside lots of other parallel routes. And we also need clear ownership of who does what in the practice. So auto registrations should be treated as touch-free. No action is needed unless something is flagged or unless some information is needed to be transferred from that PDF document. Manual registrations and exceptions handled by a named role, so usually with a simple daily check rather than constant monitoring. And that clarity makes a big difference because everyone knows which registrations need attention and which ones don't. And the other bit is about ownership, so be clear who is responsible for monitoring GPREG, who picks up the exceptions if something doesn't flow through automatically, and what happens if that person is off. Without that clarity, teams tend to double check everything, which is where that time gets lost. Another key step is removing duplication. So if GPREG is live, practices can start to stop parallel paper forms, reduce those manual emails being sent or checked, and avoid re-entering information that's already been submitted digitally. And practices that do these bits consistently tend to save around 2 to 4 minutes, and that's per new patient overall. So that's whether it's GPREG or through another way. And that might not sound much, but across dozens or hundreds of registrations a month, it quickly becomes hours of admin time that is released. And this is often the hardest part to talk about, but it's also the most important. So automation doesn't remove the need for admin teams. What it does is change what their time is spent on. So when GPREG and auto registration are working well, some tasks simply don't need doing anymore. So like re-entering the information or manually processing every registration. And that definitely doesn't mean that admin work disappears, as we all know. It means that time is released. So admin can redirect that time into higher value work, things like proactive recalling, chasing QoF activity, or supporting patient messaging and follow-ups. These are all areas that admin already add huge value to, but often don't have the capacity to focus on. And where practices struggle is when the technology changes, but the roles and the expectations don't. And if everyone continues working as if registration needs that manual input, the time savings never become visible. So this is about normalizing change, not threatening jobs, agreeing what tasks can stop, being clear about where this time could be reinvested, and making sure that admin teams are supported throughout the whole transition. And when roles evolve alongside the automation, practices don't just save time, they can use that time more effectively. And registration is one of the few moments we get when every new patient is paying attention to us. That's why it is the best opportunity to set expectations and guide behaviour from day one. So make sure you do this when patients join your practice. If you don't use this moment, patients will default to what they already know, usually phone calls and walking into the practice. When we talked about messaging templates, they can be built for new patients earlier. Think about all of the information that you could include on there. So a welcome message, confirming registration and signposting to the NHS app. And at this point, patients can also be directed to the practice website that includes information on simple guidance on how you prefer patients to contact you, online services such as appointment requests or triage, repeat prescription ordering, and then digital messaging routes for non-urgent queries. And when patients know how they're expected to use your services, practices see a reduction in avoidable inbound calls, particularly from newly registered patients. So registration becomes more than just an admin step, it becomes a behaviour setting moment for practices. And GPREG works best when patients already know about how registration works before they even contact the practice. So starting with the practice website, it's about clarity, a clear register with us page, as Ian said, with plain language explaining what happens next, how long registration usually takes, and that there's no need to call the practice. Outside of the website, simple social media posts can reinforce the same message. So think about popping some posts on there about, are you a new patient? You can register online, give them some more information there. I'm sure Ian and his team probably have some assets that you could use for that. And pin those posts so that it quietly shapes expectations. And practices can extend these messages into the community as well. So think about putting posters in places like community centres, libraries, pharmacies, local council buildings, or voluntary and community sector venues. It's a great example of how small, joined up communication changes can support GPREG and protect that practice time without creating extra work for you. And I know some people have asked some questions about how you get your data for GPREG, but from next week, we'll be adding GPREG registration data into our Edge tool. The GPREG team have kindly agreed to share that registration data with Redmoor, which means that we can bring it into our Edge tool alongside the other primary care data sets that many of you are already using. So for those who haven't used Edge before, it's a dashboard that brings together data on capacity demand, access, and patient experience all in one place. It includes things like NHS app activity, as well as insights from GP surveys, online consultations, telephony, and there's some income-related data on there. And by adding GPREG into this mix, practices, PCNs, and systems will be able to see registration activity in context rather than isolation. So you'll be able to view averages, percentiles, and benchmarks at practice, PCN, ICB, and regional level without needing to pull multiple spreadsheets together. The dashboard allows you to filter by geography and time period, look at baseline performance, and track change over time. And the intention is to make it easier for you to understand where you are now, spot variation, and identify opportunities to improve, particularly around admin, workload, and digital uptake. So Edge is available through our Digital and Transformation Hub. If you don't have access to this and you'd like to, please pop something in the chat or contact us afterwards and we'll let you know how. This new GPREG view is designed to support your planning for this and save time by giving you some clear, accessible data all in one place. And then I just wanted to talk briefly about what we can add alongside the national GPREG capability. That as we've said, GPREG itself is the core national solution. And what we focus on is helping practices make it work in the reality of day-to-day practice. At a practice level, that usually starts with stepping back, looking at current versus future workflows. Many teams are running GPREG alongside those existing processes, which can lead to that duplication or extra handling. And we can help practices identify where steps can be removed, simplified, or joined up. And a big part of this is linking GPREG with NHS app and with patient messaging. And that way the patients get clearer communications about what's happening with their registration. Practices aren't relying on manual follow-up or unnecessary phone calls. And the aim of it isn't to make more digital for the sake of making more digital. It's to make clearer processes and better communication for both staff and patients. And we also support practices with patient communications before registration even starts. So for some practices, this includes our social media managed service. We can use that to explain the registration process in plain language, so patients know what to expect before they submit that GPREG form. And that again can reduce those inquiries that you get at a practice. And at PCN and ICB level, the focus shifts to scale and consistency. Rather than every practice solving the same problems in isolation, this is about sharing what's working well. We can come up with some common templates and support a more joined up approach across an area. We also support systems to understand the impact of these changes, so particularly in terms of admin time saved, and that helps move the conversation away from anecdote and more towards something that can be evidenced and built on over time. So all of this is supported through the Digital and Transformation Hub, which provides a structured way to learn with resources and support. If you'd like to find out more about the ways we can support you, please get in touch with me. My email is on these slides here, but I will pop it in the chat as well for you. Well, thank you very much, everybody, for joining. We would be grateful if you could fill out our feedback form for today's session. It really helps us to know whether we are hitting the right spot, giving the right information. If you fill it in, you'll also go into a draw to win a £25 Amazon voucher. So 5 minutes of your time is much worth it if you spend as much as I do on Amazon. Yeah, weighing up your odds, Jack. It's a monthly draw, so you'll be in with the rest of the monthly webinars, but you still have a chance. But it's really useful for us to get some feedback to learn if we need to include any more information on future sessions. But yeah, thank you very much for joining us today. I hope you found it useful. Thanks very much to Ian.
You're
It's
welcome.
been great to learn about GPREG and the auto reg feature. If we haven't been able to cover anything that you want to know, please email myself, or you can contact Ian and the team. But thank you very much. We will pop everything in the D&T network after this, and we will send you an email to let you know where that sits. But thank you, and enjoy the rest of your day.